Hi, this is Lynn Fitzgibbons. Thank you for joining this third COVID-19 community update with a focus on the Santa Barbara County area. It was another important fortnight with the epidemic in our area, and we are seeing the start of some big changes in our community condition. As with prior updates, we'll start by looking at the state of the epidemic around the country and around our state, before focusing on our own community of Santa Barbara County. Of course, the biggest news this week has been the new regional stay-at-home order, which leads to important questions about our regions and then our counties' ICU and hospital capacities. I'll then give an update on vaccines, including a dive into the recently released information about the Pfizer vaccine's benefits and side effects, which were published in the New England Journal of Medicine last week. And the vaccine, of course, now authorized by the FDA for emergency use. And finally, we'll finish with some pearls, or the bullet points to keep in mind for the week ahead. I always like to begin by reviewing and understanding the bigger national picture before drilling down to our own state and community. Unfortunately, the big picture is looking quite grim this week, with record numbers of new cases diagnosed every day, record numbers of people in the hospital today with COVID-19, and very tragically, we are now seeing record numbers of deaths. As we've talked about in the past, it's important to remember that both hospitalizations and deaths will increase several weeks after cases increase. If someone is going to tragically, for example, lose their life to this infection today, they are likely to have been hospitalized 1 to 3 weeks ago, and even farther back, they were likely diagnosed and therefore included in the daily case probably several weeks ago. This is unfortunately just a reminder that as our nation's daily cases and hospitalized curves are surging substantially, we know deaths will only continue to rise across the country, exceeding likely even the record of 3,100 deaths per day that we saw at the end of last week. In California as a whole, we continue to see similar changes. Those of us who followed the data closely over the summer remember those notable days when we learned that more than 10,000 new cases were diagnosed in a single day in July and August. At that time, for us to see more than 10,000 daily cases in California was both newsworthy and remarkable. I remind us of this as we hear that California had more than 35,000 new cases diagnosed last Thursday. This huge difference compared to even the worst days of the summer is a good example of just how different this chapter of the epidemic in California has been compared to anything we've seen so far. We certainly have more healthy, asymptomatic, and milder cases being diagnosed, but unfortunately, we are also feeling this in the hospitals. Again, reinforcing the severity of this current surge during this current chapter can be seen in our current hospital census. In other words, the number of people with COVID-19 currently admitted to the hospital, now around a staggering 14,000 in the state of California. We can also see here the impact that these high hospitalizations are having on the available ICU beds across the state. You'll notice a very sudden drop in late July, which was related purely to a change in the way the state tracked these available beds. But the most concerning area, and the part I'm focused on right now on the chart on the right, is of course this quite dramatic dip that we've seen in the past 2 to 4 weeks in available ICU beds across the state. We'll come back to this, of course, as we look at the regional stay-at-home order. And finally, looking at the last 2.5 months since the beginning of October here in Santa Barbara County, we see the daily reported cases to the Santa Barbara County Public Health Department. And we see a continued rise in new cases really in the last 6 weeks. Many of us remember as recently as October when Santa Barbara County sat squarely in the state's red tier for reopening, with many of us eyeing that threshold to drop into orange and again open more of our economy. Unfortunately, of course, we transitioned quickly to purple in early November, and the numbers have continued to worsen week over week. For a point of comparison, I include here the thresholds. The top one would be our threshold to transition back out of purple, and the lower one would be to transition from red to orange. As you see here, unfortunately, we have now far exceeded any conversation in the coming weeks about these thresholds. So let's talk about the regional stay-at-home order. During our last community update, we reviewed the strains that the epidemic in California was beginning to have on ICU capacity. We had looked at how full our ICUs were around the state, as well as how much more quickly they were filling, and when the state projected they would actually be full, essentially when there would be more critically ill patients than we had ICU beds for. If you remember that the graphic, the picture throughout California looked grim, but there were some important differences between different regions throughout the state. And it was with this in mind that the state health officer issued the regional stay-at-home order last week. Hospitals are required to submit information on the total number of staffed ICU beds available daily. This includes adult beds primarily, and this is tracked very, very closely across the state of California. The regional stay-at-home order that was put in place last week said that within one of the 5 defined regions, if the ICU capacity fell below 15% availability, then that region would be put under this new regional stay-at-home order. The regions we're all familiar with, but most important for us in Southern California, of course, is the very expansive Southern California region. Stretches all the way up the back of the Sierra Nevada mountains, down to the Mexican border, and then up past Ventura, Santa Barbara, as far as San Luis Obispo, a very large Southern California region. Over this past weekend, we learned that not only had our state the previous week fallen below 15% in several regions, but in Southern California, we of course fell last weekend below 15% and the regional stay-at-home order was enacted. And this past weekend, unfortunately, we've learned that not only did our region's ICU availability drop below 15%, but we are now, as a Southern California region, down to 4.2%. The closest other region to us in Santa Barbara County, of course, the San Joaquin Valley, down to a quite remarkable 1.5% of available ICU beds for that region. So let's look very specifically at Santa Barbara County. Looking at what we call the hospital census, or again, the number of people admitted to the hospital with COVID-19 across Santa Barbara County, since the beginning of the epidemic back in March and April, we see that huge summer surge in the middle of this graph, but then a very steep curve of increasing hospitalized patients in just this past month on the far right. The lower dark curve is the number in the ICU, while the top curve is the total. As we would expect, we saw this number increase, the ICU number increase 1 to 2 weeks after the general hospital numbers increased over the summer. We know that patients are often admitted to the hospital for a number of days, perhaps a week, perhaps a bit longer, before their condition may deteriorate such that they would need to be in the ICU. Of course, other patients don't need the ICU. Other patients are in the general wards of the hospital. They're cared for, they recover, and they discharge after a small number of days. What we're seeing currently is a leading surge in the general hospitalized numbers. We're not yet seeing a substantial change in our ICU needs across the county of Santa Barbara, but again, we know that this is a lagging indicator. We know that this ICU number trails the general hospital trend, and the general hospital trend in the last 2 or 3 weeks has of course been quite dramatic. Here we look at the ICU availability. In other words, the percentage of adult ICU beds that are still unused and available from the beginning of October to this past weekend in the region of Southern California on the bottom line, and in Santa Barbara County in the top blue. Santa Barbara County is a relatively small place compared, of course, to the huge Southern California region. And so the line in Santa Barbara County is quite jagged, with just a few admissions or discharges into or out of an ICU on any given day, potentially really changing the curve a lot. For context, we have approximately 90 ICU adult beds available in Santa Barbara County. And so even a small number of new admissions to the ICU or discharges from the ICU can make this line change quite a lot. Nevertheless, the overall trend has been perhaps stable to slightly decreased over the past 2 to 3 weeks. And we compare that, of course, to what's happened to the Southern California region's beds. As a huge region, the line is less jagged, but of course now plummeting down below not just the 15% threshold in the orange bar, but now down, as we've learned, to 4.2% entering this week. Given all of this, how can we tell what is ahead for our community? And I have to say that this week, this chart is the most helpful to me. Here we see cottage health specific data from the beginning of the epidemic until yesterday. And what we see here are the number of COVID-19 confirmed admissions to cottage health every week. We, of course, remember the beginning when we had a smaller number of patients admitted, and then control, and then we had that big surge over the summer with somewhere between 25 and 30 new COVID patients admitted to cottage. And then, of course, improvement, and through the fall, things were quieter. But what worries me the most of everything this week is what we are seeing over this last 3 weeks. What we have seen is a very rapid acceleration in new admissions to the hospital. I point this out because if we think, for example, of hospitals in a very simplistic way, perhaps as we think of a room, and the hospital census tells us how many people on any given day are in that room. But if we want to try to predict or understand or make our best guess as to how full that room is going to be a week from now, 2 weeks from now, or a month from now, of course, the most important thing to monitor is how many people on any given day or week are entering that room. Remembering that once you enter that room, or of course are admitted to a hospital, you will likely be there for several days, and some people, of course, in that hospital, or again, simplistically in that room, for several weeks. And so when I look at this graph and I see this very dramatic change in the number of new admissions to the hospital over this last 3 weeks, now at record levels here at Cottage Health and around our region, we know, unfortunately, that our hospital census is going to continue to grow, the number of people in the hospital on any given day. And we worry, of course, that next week we could see even more admissions. So what happens when ICUs are full? Perhaps the most important question. And of course, the answer is not that we stop caring for patients. Every hospital, every nurse, every physician, every healthcare worker across our region, across our county, across all of our systems is committed to continuing to care for patients even once we cross that threshold. And so what we do is we would perhaps repurpose beds that wouldn't otherwise be used for ICU level care, perhaps other beds around the same hospital. We also know that there's often the opportunity to transfer patients throughout a community or throughout a region. And finally, we know that the state talks about alternative care sites and what are called California medical stations, essentially smaller pop-up field hospitals that they have in reserve ready to deploy around the state if they're needed. Ultimately, staffing is probably the biggest concern. While many hospitals, I would venture to say most hospitals around California will have the ability to again find alternative beds perhaps for patients within the walls of their hospital system, what is going to be increasingly challenging is finding the staff to care for those patients, to find experienced and skilled nurses, to find physicians, to find all of the other critical healthcare workers to care for a potential dramatic surge in patients. So let's transition and finish up with some vaccine updates. The Pfizer vaccine, of course, endorsed by the FDA Advisory Committee, data published in the New England Journal of Medicine last Thursday. And then on Friday, we heard the great news that the FDA has issued an emergency use authorization for the Pfizer vaccine. A rapid distribution is now underway across the country. And the first vaccines are going to go to frontline healthcare workers as well as elderly residents of long-term care facilities. Really a remarkable effort on so many levels to get this vaccine, which again is based on a new technology, mRNA vaccine, really through a remarkable number of the usual bureaucratic and administrative hurdles in an incredibly efficient way this year. The New England Journal of Medicine published the data and they've made it free and publicly available. And anyone who's interested, I would encourage you to find the article and look at it, particularly at the graphics. I'll show you a few here. To answer the two most important questions, how well did it work and what were the side effects? It worked remarkably well. Here we see on the left-hand side the number, the distinction of people who developed symptomatic COVID-19 and people who developed severe COVID-19. And we see it broken down by the approximately 18,000 people who received the vaccine and the other 18,000 people who received simply a placebo or an injection of saline, salt water, with no active vaccine. And again, just a remarkable difference here. Those who received placebo, in that group, there were 162 cases of COVID-19. And in those who received the vaccine, again, about the same huge number of people as received placebo, but those who received the vaccine, there were only 8 cases. And when we think about severe COVID-19, 9 patients, unfortunately, who received placebo developed severe COVID-19, and only 1 out of 21,000 in the vaccine group developed severe COVID. Again, these numbers are what leads to the report of 95% efficacy or benefit. And again, this is just really a remarkable feat. This graph is, I think, perhaps the most encouraging with regards to the speed that we're going to see benefit from this vaccine. On the x-axis, we see the number of days since a person in the study received their injection of either vaccine or of placebo. And in the y-axis, the top axis, we see the incidence of developing COVID-19. And what is so very remarkable is if we first follow the placebo group, as we would expect, this placebo group was living, of course, during this year, during the pandemic, and continued to be exposed to COVID-19. And so as we would expect, the placebo group continued to slowly, day over day, week over week, and month over month, they continued to develop COVID-19 in a very linear fashion. The vaccine group, however, in red here, for the first week, they didn't yet have any benefit from the vaccine. And so some of them did unfortunately develop COVID-19. But right around the 10th day, right around days between 8 and 12, suddenly we see really a change, a split in this curve, where the vaccine group suddenly stops developing COVID-19 and presumably has now protection. And again, this curve, I think, tells us that even though this is going to be a 2-dose vaccine given at day 0 and day 21, really after that very first dose, we see a quite remarkable protection. Again, very, very reassuring as we think about the surge in the epidemic currently. So how safe was it? Well, the vaccine recipients did, the majority, have what are called local reactions at the site of the injection. They developed some pain, erythema, in other words, redness, and some swelling. There was also a fair amount of what we call systemic reactions. This is the whole system, the whole body. These would be things like fevers, headaches, myalgias, or muscle aches. And the people who received the vaccine developed more of these than those who just developed or who were just given the placebo. And those reactions, those systemic reactions, were a little bit stronger after the second dose of that vaccine, presumably because the immune system was already primed and ready to react. The good news is that most of these were mild to moderate and resolved rapidly. And anyone who's interested, I would encourage you to look at the New England Journal of Medicine article, and there's a table, there's a figure dedicated just to side effects, and you can look and you can see it broken down by those younger than 55 years old, those older than 55 years old. You can see exactly what percentage developed mild side effects versus moderate side effects versus the very small number that developed any severe side effects. Really, I think a good source of information for us all. So what are the remaining questions? Of course, we only have this data out to 2 months. Very, very impressive that it was showing so much protection within those 2 months, but we still, of course, have not yet been able to follow these patients past 2 months. And we did focus with this study on healthy volunteers. And so we only have data down to an age of 16. We don't yet know about this vaccine in children or in pregnant women, or for example, in people with immunocompromising conditions. This, remember, is not a live vaccine that we tend to avoid in immunocompromised persons, but we still don't know how well it would work or if there would be any unique considerations for immunocompromised people. We also don't know whether the vaccine protects against asymptomatic infection. We know that it prevented people from developing symptoms and COVID-19, but what we don't know yet is whether it also prevents people from becoming infected and just not showing it, which of course has big implications when we think about the vaccine as really a license to stop using masks or stop using all these other good protections that we're using. And we also don't know that if you get the vaccine and you are exposed to this virus, could you still pick it up and pass it on to someone else, even if you yourself don't get sick? And finally, we don't really yet know how to deal with those who missed the second vaccine dose. Remember, this is dosed on day 0 and then day 21, 3 weeks later for the Pfizer vaccine. The good news is, even after that first dose, people seem to be very, very protected. But what we don't yet know is whether that second dose is going to be really important with how long that protection lasts. We wonder, of course, if we're going to have to need boosters of this vaccine, perhaps after a year or a small number of years. We'll understand and learn much more about this vaccine down the road. And what we don't yet know, again, is whether someone who receives only 1 dose is going to be less protected than someone who receives the full recommended 2-dose series. So finishing up with some pearls for this week. The surge in COVID-19 cases clearly continues with week-over-week records in case count, hospitalizations, and now with deaths rising. This post-Thanksgiving bump is clearly hitting Santa Barbara County this week, I would say, with case counts climbing and a sharp increase in new admissions to the hospital. The Southern California region as a whole is approaching its ICU capacity. Santa Barbara County, of course, differs from the rest of our region in several very important ways. Our ICU capacity is currently intact locally at about 30 to 40%. Our geographic location is one of several factors that result in Santa Barbara County generally trailing the region by a few weeks in several metrics. Remember, as the region's case positivity increased, Santa Barbara counties did so, but did so 2 to 3 weeks later. Similarly, daily case counts per 100,000 residents. And again, we worry that the impact on our hospitals may well behave the same way. And finally, it's important to remember that Santa Barbara County is also different in that we are a smaller county with a smaller number of adult ICU beds. Right now, we have very good capacity locally, but we're certainly vulnerable to perhaps an outbreak that would impact hospitalizations and ICU admissions in a way that could very, very quickly change our capacity locally. And finally, I think in very exciting news, the Pfizer vaccine efficacy and safety information is now readily available for us all to review. And my opinion is that it looks very promising, with the FDA EUA now in place, as well as the West Coast Independent Advisory Board issuing a strong statement of support yesterday. And I think really, as I continue to say, as we all, I think, continue to hear, the exit from this very, very difficult time, I think, is within sight. Let me just finish by asking everyone to please continue to stay safe, keep your circles small, support one another, and of course, wear your mask. Thank you very much.